Hey guys, thanks for popping back on the channel today. Put a quick video together to talk more about some special considerations when we're discussing the age of individuals that may experience cardiac events or emergencies. So really the child, adult versus the infant, really. So what is the main difference that we have in terms of skill we provide based on the size of the person? So with that said, the very first important thing is, how do we identify the age of an individual so we know what kind of care to provide? So the infant is going to be any individual under 1, so newborn to 1-year-old. The child is going to be the age of 1 up to about puberty, oftentimes around 12 years old, or they're less than 55 pounds. The adult is going to be anybody post-puberty, older than 12, or heavier than 55 pounds. So when it comes to CPR skill, adult and child are pretty similar. There's a couple small differences. We'll start with the adult. So we use a hand-over-hand, two-hand technique on the center of the chest. We push at least 2 inches deep on the chest at a rate of 100 to 120 compressions per minute. So that's for the adult, right? We will open the airway past neutral after our 30 compressions, pinch the nose, give 2 ventilations about 1 second apart from the other, assessing the chest to rise and fall, meaning our air goes in the lungs. When it comes to a child, we might need to, or it might be more appropriate to use a one-hand technique versus a two-hand technique, because we're only pushing about 2 inches. So in other words, for a child, it's slightly less on how hard or the depth at which we push. The other thing is the airway management piece to this, where we only go slightly past neutral. So in other words, we don't want to hyperextend or flex the neck by pulling too far back, so it's a slight past neutral airway management technique. We'll still pinch the nose and we'll still give 2 breaths, again, 1 second apart from each other, assessing chest rise. Infant's going to be a little different. We have a couple techniques we can do based on the size, right? So that's newborn to 1. We can use the encircling thumb technique to give infant compressions. So this basically looks like fingers to the baby's rib cage, thumbs to the center of the chest, just below the nipple line anatomically. We're going to compress the chest about 1.5 inches for an infant, so it's even less than a child or an adult. The other technique is the 2-finger technique, so we've seen this a bunch if you've ever been trained before. We have 2 fingers, the first and second, or the third and fourth finger. Sometimes those fingers that are more similar in length might be easier for you, and we'll push straight downward 30 times. This time now, when we go to give breath after our 30 compressions for the infant, we want to go a neutral airway position. So in other words, we're not going to hyperextend or flex the neck back. Number 1, preventing head, neck, and spine injury. Number 2, having the tongue fold back and actually block the airway could possibly happen as well. So again, we're going to keep the airway at neutral. We will not pinch the nose for babies. We make a complete seal over their nose and their mouth for a baby, and we give 2 ventilations about 1 second apart, looking for their chest to rise and fall. All right, so there are a couple differences in terms of skill. The other technique that you could use for CPR compressions on the infant is if you cannot do the encircling thumb or the 2-finger technique, you can use the one-hand technique. Maybe not the most appropriate, but it certainly is accepted, and it looks the same as it would for a child, right? Just keep in mind, depth is important, so we're only pushing for a baby 1.5 inches, so you want to be aware of those things if that's ever a situation you encounter. So in any case, it's 30 and 2, 30 compressions, 2 breaths. Just the way that we give them and do them is going to be a little different with each age group that we have, infant, child, and adult. We have other videos on how-tos as well as some live demonstration using equipment and mannequins that you can follow along on the channel. So make sure you subscribe, check out those videos as well, where we actually walk you through the steps and what it looks like in practice, and kind of break that down a little further. So if you have any questions, as always, feel free to reach out. Thanks and have a good one. Thanks for joining today.